Establishing an intravenous line, peripheral IV line. Learning objectives. By the end of this video, the participants will learn to prepare an intravenous infusion set, to identify the peripheral vein for establishment of the intravenous line, to insert a cannula to establish IV line under all aseptic precautions, to secure and maintain an IV line, to remove the IV line. Indications for giving IV fluids and medications, for giving blood transfusions. Equipments: IV cannula 24G for newborns and 16 or 18G for adults. 3-way stop cock. Syringe. Normal saline. Cotton. Spirit. Iodine. Splint. Adhesive tape. Micropore. Scissors. Sterile gloves. Tourniquet. Sites for insertion of an IV line. The preferred sites for IV cannulation are hand or arm, where you can easily locate the vein. In some cases, foot or leg can also be used. If there is an emergency, you can select any prominent vein for easy and quick insertion of the IV line. However, in routine cases, the veins should be selected first from the periphery and later on, if needed, move up from distal to proximal. Steps for IV cannulation: wash hands and wear sterile gloves. Check the expiry date. Prepare the IV set with the solution to be infused. Select the correct size IV cannula. Open the IV set. Insert the IV tubing in the bottle. Ensure that the entire infusion set is filled with fluid and that there is no air in the infusion set. Once the desired amount of fluid has been taken in the PEDIA drip set, close the stopper. Select a prominent vein. Hold the extremity or use a tourniquet to make the vein prominently visible and easy to cannulate. Clean the skin over the vein using a spirit swab by circular motion from center to periphery and allow it to dry. Apply povidone iodine solution in a similar manner. Allow it to dry. Repeat the step using spirit swab. Allow it to dry. Insert the cannula at a 15-degree angle through the skin with bevel of needle facing upwards. Once the blood is visible in the hub, gradually withdraw the stellate and advance the cannula. Remove tourniquet or hand pressure. To obtain a blood sample, place the sterile vial or centrifuge tube under the hub and collect free-flowing blood. Flush with 2 ml normal saline to ensure patency of the cannula. Remove syringe and close the hub with a stopper. Secure cannula with micropore tape. Ensure visibility of the cannula tip area for early detection of extravasation. Stabilize the hand or arm for restricting the limb movements. Ensuring that there are no air bubbles. Attach the prepared infusion set to the cannula after detaching the needle from the IV set. Needle to be disposed as per Biomedical Waste Disposal Guidelines. Procedure for IV cannulation in an adult. Clean the skin over the vein using a spirit swab by circular motion from center to periphery and allow it to dry. Apply povidone iodine solution in a similar manner. Allow it to dry. Repeat the step using spirit swab. Allow it to dry. Insert the cannula at a 15-degree angle through the skin with bevel of needle facing upwards. Once the blood is visible in the hub, gradually withdraw the stillet and advance the cannula. Withdraw blood sample before attaching it to the IV infusion set. Document timing of intravenous access and medications given on the bag or bottle of the IV fluid. Inspect the infusion site frequently for any swelling or redness in order to detect extravasation, if any. Keep checking the IV fluids and the rate. Ensure to refill the fluid bottle or bag before it gets exhausted. Once the indication is over, remove the IV cannula and press the site for 3 to 5 minutes. Do not strap it with adhesive. Troubleshooting. During IV cannulation, you may encounter some problems like: in case the vein is not visible, prepare for venous cut down in adults and umbilical catheterization in the newborn. If redness and swelling is seen, it suggests extravasation of fluid. Stop the infusion, remove the needle and establish a new IV line at a different site or vein. Later on, do Magsulf glycerine dressing. Do not massage the area. Shivering or rigors may occur. Immediately stop the fluids and inform the medical officer on duty. Give anti-allergic or steroid drugs. Reaction to the fluid or medicine or blood may be the cause. Recheck the expiry. Some of the common complications following IV cannulation can be thrombophlebitis, infection at the site of insertion of cannula, extravasation of fluid in subcutaneous tissue may cause infection and tissue necrosis. Key points: IV cannulation is indicated for giving IV fluids and medications. Follow aseptic precautions before insertion of cannula. Monitor the infusion rate and ensure that the bag or pedia drip set is changed or refilled before the fluid finishes. Stop the fluid if shivering or rigor occurs.